Good morning, everybody. I take this opportunity to thank Dr. Ashok Shroff, my dear friend, for giving me this opportunity to be here. I will continue from where Dr. Himanshu left, and he very nicely described what monovision is. But we found that sometimes people are not happy with monovision, and only about 70% of clearly well-chosen patients are happy with monovision. But there are an occasional patients who are not happy, and they would require something more than monovision. And today we have an approach which would cause a little more than monovision, helping a person to see well without glasses, both for distance and near. And I'm a consultant to Carl Zeiss Meditech, which has developed this technique with the help of excimer laser, the MEL-AT. If we rate different approaches which would correct presbyopia, we have to rate them in the following terms. We have to see how much of the hampering of the far distance vision occurs to gain the near vision. Are there any likelihood of subjective problems like diplopia, loss of contrast, early cataract formation? How permanent is the change? And if the patients don't like it, how easily or is it possible to reverse or enhance whatever you have done? And the basic truth today is that so far there is no presbyopia approach which is all of the following. That it works in all or almost all cases, that it has stable changes, has no subjective issue, and has no distance vision compromise. So if you are looking for an ideal solution, today there is none. But laser blended vision seems to be needing the least compromise in the above issues, and I would like to discuss with you. For that, we first need to know monovision, because part of blended vision is also a micro monovision. As Dr. Himanshu already pointed out, it's a satisfactory solution for patients in the age group of 40 to 50, but not beyond this, and about 70% of the patients are pretty happy. Less aggressive, but it only reduces dependence and cannot eliminate it. Works well in patients who believe it would work well, and if in case they are not happy, they should be ready for an enhancement which would clear their distance vision, but they would still need reading glasses. Laser blended vision uses the concept of micro monovision, so you are not really dissociating the two eyes too much, but this is not purely monovision. It is enhanced by non-linear aspheric profiles, and by that I would just explain to you in a little later. For that we need to know first the influence of spherical aberration on the depth of field. Now if you have a system where there is no spherical aberration at all, then you would have an ideal sharp focus where you would see very sharp, but anything beyond or in front is not so sharp at all. While if you have a spherical aberration in your eye, which is in the positive notation Z40, you would have a circle of least confusion where you would have a maybe slightly less sharp image at the point of focus, but you could resolve letters which are beyond and in front also pretty well. Now this we can make use of if you want to understand in terms of the Snellen's acuity. If somebody has no spherical aberration and has 7 millimeters of pupil dilatation, if he is an immetrope, this is what he sees for distance. Now if you were to put a plus 0.5 in front of his eye, the vision quality would deteriorate, and further with plus 2 in front of his eye, he would not see anything at all. So letters don't appear like letters at all. While if you have in this same person a spherical aberration either induced or present, then when he is immetropic he sees this, but when you add a plus 0.5 and subsequently a plus 1, 1.5, plus 2 also, he can still resolve letters as letters, which means that his distance vision doesn't get as much compromise as you think it would be if you make him a -2 diopter myope. Because that's what you mean by putting a plus 2 in front of your eye. Now if you have to add the effect of pupillary diameter on the depth of field, first of all, if you have a big pupil diameter of 7 millimeters, again the same effect. If you put a plus 2 in front of your eye, you don't see anything at all. But if your pupil is small, then you are still going to resolve letters as letters. Now if we combine both these effects, this is what happens. It's a much better resolution even when you put a +2 in front of your eye. Now how do we make use of this? This is made use of by increasing the porosity in the center of the cornea. So you basically make a non-linear aspheric profile on the patient's eye, and this would cause an increase in the depth of field. So laser blended vision combines the depth of field with micromonovision, and this combination works pretty well. If you are looking for an ideal solution, of course you should be able to see at all these distances clearly. If you were to only increase the depth of field by changing the porosity on the cornea, this is all that you would get, because beyond that, if you increase the depth of field, the quality of vision will suffer. So patient will not be able to tolerate it. So if you were to just add the aspheric profile, the patient would be able to see for distance very well and some amount of intermediate, but will not be able to actually read close things. So what you now need to do is borrow from contact lens monovision. What happens in contact lens monovision is that there is a dominant eye which looks for distance, a near eye which looks for a non-dominant eye which looks for near, but there is a blur zone in between which so many people do not tolerate, and that's where the failure of monovision occurs. Now when you add this depth of profile to the eye, what happens is that you've already increased the depth of field, and now if you were to make this patient slightly myopic in the non-dominant eye, say by about a 1.25 to 1.5 diopters, then instead of a blend zone you have instead of a blur zone you have a blend zone, which would make almost 97% of the patients accept this procedure well. And I have a living example, of course, in the house, but it works well. And it works definitely better than my pure monovision, and it is worth a try for patients who have no lenticular changes at all and developed presbyopia. Thank you.